Hi everyone, my name is Kimberly Reyes and I will be talking about childhood psoriasis, specifically affecting those 0 to 12 years of age. Because of the age group, my target audience would be my fellow pediatric dermatology nurses. Childhood psoriasis, it's more than just skin deep. So, let's get started. So, what is it? Psoriasis is a chronic, incurable, non contagious disease of the immune system that appears on the skin. Psoriasis appears on the skin as dry, red, scaly, itchy plaques. In more severe cases, psoriasis can affect the joints, causing agonizing joint pain. According to the National Psoriasis Foundation, it is the most common autoimmune disease in the United States. It affects as many as 7.5 million Americans. Approximately 40% of adults with psoriasis report the onset of their disease occurred in childhood. Approximately a third of patients report the onset of psoriasis before 16 years of age. If onset occurs before age 2, it is termed infantile psoriasis. Symptoms. Psoriasis appears on the skin as red or white, dry, scaly, flaky, itchy, thick plaques. Up to 30% of people with psoriasis also develop psoriatic arthritis. Psoriatic arthritis is a form of arthritis that can cause agonizing pain, stiffness, and swelling of the joints. Psoriatic arthritis can also induce nail psoriasis by affecting the connective tissue between the tendon or ligament and bone, causing nail dystrophy, which is abnormal nail growth. Psoriasis most commonly affects the elbows, knees, buttocks, back, and scalp, but really it can affect anywhere on the body. Although the exact cause of psoriasis is still unknown, it does have a familial genetic tendency, which is non-modifiable. The red scaly plaques that are associated with psoriasis are caused by T-cell mediated chronic inflammation of the skin, causing hyperproliferation of keratinocytes. A T cell is a type of lymphocyte that is produced by the thymus gland and actively participates in the immune response. Lymphocytes, a subtype of a white blood cell, play a central role in cell-mediated immunity. In psoriasis, the life cycle of skin cells are affected as cellular proliferation is significantly increased, causing cells to build up too rapidly on the skin surface. The process of skin cells growing in the innermost layers of the skin and then rising to the surface typically takes weeks. But with psoriasis, this process occurs over only 3 or 4 days. This causes buildup and thickening of the dermis and epidermis as dead cells cannot be shed fast enough. Although hereditary factors are considered non-modifiable, there are modifiable factors that can help prevent flares and triggers of the disease. Environmental triggers initiate disease activity in young children. The more common triggers in childhood are an upper respiratory tract infection, pharyngitis, stress, and trauma. Streptococcal infections in the upper respiratory tract, such as tonsillitis and strep throat, are known to trigger psoriasis in children and young adults. Infectious rhinitis, or the common cold, is a common viral upper respiratory infection. The transmission of the infection is through close physical contact with the virus, through exchanges with other humans, like shaking hands, or surfaces like doorknobs and telephones. Transmission can occur through both inhalation and physical contact, so the hands are virally contaminated 60% of the time. People in closer contact with other people are at higher risk for developing infection, such as daycares. It is general knowledge that children enrolled in daycares get sick often. The exposure to these viral respiratory infections can then trigger psoriasis in genetically predisposed children. To avoid these triggers, hand hygiene is extremely important, as covering one's mouth when coughing or sneezing and also utilizing face masks when appropriate is beneficial in helping to control viruses from spreading. Additionally, parents should be educated that sick children should stay home so that other children are less likely to contract an illness. These simple steps can help avoid unnecessary triggers and flares of the skin disease. Another important tip is for the patients to always avoid irritants. Um, one should avoid harsh skin cleansers and perfumes, especially hand sanitizers, which are alcohol based, and they are extremely drying and irritating to the skin. You should also avoid aggressive scratching, thickened plaque areas, as this can cause increased irritation to the skin. Also, when showering, avoiding vigorous or harsh scrubbing, such as with a loofah, which can also worsen the symptoms of psoriasis. Another really good tip, since you can't tell a little baby to not scratch, you can apply socks or little mittens to their hands so that they can um, not scratch. So treatment of psoriasis typically includes topical emollients such as Hydrofor, Aquaphor, Vaseline, CeraVe, or Cetaphil. Just a side note, the greasier the better. So something greasy like Hydrofor, Aquaphor is really, really great to lock in moisture. Another good tip too is to apply these topical emollients like within 2 minutes or 1 minute from after you take a shower. You want the skin to not dry yet. You want to apply it to kind of moisten skin. That way, the greasy emollients can kind of lock in the moisture better. Topical steroids are a really great treatment for psoriasis as well, such as triamcinolone, fluocinolone, and clobetasol. Oral prescriptions are also prescribed, such as methotrexate. Phototherapy is used, and certain biologics such as Humira, Enbrel, and Stelara. So for those of you who don't know what phototherapy is, it involves exposing the skin to ultraviolet light on a regular basis and under medical supervision. Ultraviolet light is an effective treatment for psoriasis as it penetrates the skin and slows the growth of affected skin cells. Consistency is very key. For maximum benefit and to achieve faster skin clearance with phototherapy, it is recommended for patients to consistently receive light therapy 2 to 3 times a week for a duration of at least 3 months. So psoriasis is more than just skin deep. Psoriasis does not only affect the skin and cause agonizing joint pain, but it has the potential to cause severe social harm to developing preschoolers and school-age children. Because of this, psychological and social support is essential in the care plan of a child suffering from psoriasis. Children with psoriasis are often alienated, called names, teased, and bullied. Bullying has been shown to cause increases in anxiety, crying, panic attacks, sleeping problems, and a decrease in academic performance. Although psoriasis is not contagious, many children frequently experience discrimination at school or public facilities such as swimming pools. Children with severe psoriasis who experience these traumatic encounters can have long-term negative effects and are at increased risk for developing depression, anxiety, and suicidal tendencies in adulthood. So something that's very, very important in the care plan of a child with psoriasis is to really talk to the child. Communication is very key. As healthcare providers, we must not only heal our patients physically, but we should also nourish them emotionally and socially as well. During a clinic visit, in addition to a routine skin exam, the nurse should also evaluate the child's emotional state and overall quality of life. The nurse should interview both the child and parents and perform depression screenings. This can be done by utilizing screening tools such as the Child Depression Inventory, or CDI, and a depression scale for children, also called CESDC. Utilizing such tools will help evaluate behavioral changes, sleep quality, recent history of anxiety, increased crying, changes in self-esteem, and decreased academic performance, all of which are signs of possible emotional distress which may require further intervention. If needed, a referral to a pediatric mental health professional may be necessary. Because of the social harm and emotional distress a child can experience, psychological and social support is essential in the care plan of a child suffering from psoriasis. A lack of knowledge and awareness is likely the driving force that causes discrimination. So, what can we do? Raise awareness. Increasing psoriasis awareness in the community, and especially those who surround the child, such as fellow classmates, teachers, and other parents, is especially important. Knowledge is power, and when people are educated and enlightened, positive behavioral changes may be manifested, and they are more likely to act with care, compassion, and humility. Another great way to raise awareness about psoriasis nowadays is to utilize technology and social media such as Facebook, Instagram, Twitter, and YouTube. You can share and post psoriasis articles and links that explain symptoms of psoriasis treatments and also highlight the fact that psoriasis is in fact not contagious. Because young children with skin diseases often lived a buried life, either by their clothing or under bandages to hide their fragile medical conditions, it may be helpful for children to be around other children who face similar issues. Camp Wonder is a week-long summer camp held in Livermore, California, where children with chronic and life-threatening skin diseases from around the country take a break from being a patient and focus on just being kid. They all share similar experiences about being bullied because they look different. Camp Wonder is a special place free of judgment, misunderstanding, and stares. It is an environment of acceptance and support to empower the children to have fun, play, and just be themselves. To conclude, psoriasis in young children is an under-recognized and misunderstood disease that can impair physical, social, and school functioning. It can add a significant psychological burden that has lifelong adverse impacts on self-esteem and mental health. Therapy goals in treating children with psoriasis not only includes a treatment of the skin, preventing further skin involvement, climate therapy, and topical therapy, but because of the associated emotional distress, psychological intervention, and evaluation of how quality of life is impacted is critical. Empowering children to have a more positive body image is also vital. As healthcare providers, we must not only heal our patients physically, but we should also nourish them emotionally and socially as well. And thank you everyone for listening. Oops. Oh, there are my references.